My name is Hilary Zeltner. I'm a licensed acupuncturist and the owner of West 57th Street Acupuncture in New York City. We are experiencing a resurgence of COVID-19 due to the Delta variant, and there are still people suffering from severe symptoms of this virus. I want as many of these people as possible to survive it. My mentor, Mr. Chang De Gu, is a long-standing practitioner of many forms of Eastern medicine, and he's developed a method of recovery for patients, people at the most critical stage of this disease. Based on traditional Taoist principles, it combines breathing techniques with ancient Chinese lung channel stimulation. It's a form of healing stimulation to activate your lung nerve function. Mr. Goos' protocol is simple and it's convenient. You can perform these exercises in your hospital room. You don't need any equipment or anyone to assist you. You can do these exercises by yourself. Watch this video of Mr. Gu and note that while breathing in and then exhaling and tapping the lung area, the reading on the finger oximeter shows the blood oxygen level rising. The exercises are working. Once the blood oxygen level rises, the patient's condition has definitely improved. This means your body is responding, and there's verifiable proof that the lungs can absorb more oxygen and your body can recover. Remember, this video is for those severely ill patients who have difficulty breathing, who have COVID-19, the Delta variant, or long-haul COVID-19 symptoms. If your blood oxygen levels are low, these exercises may keep you off a ventilator. It's hoped that through this self-rescue method, lives can be improved. Patients can experience a quicker recovery and be able to return home to their families. Watch this other video I've included, specifically developed for patients having other symptoms of COVID and the variants of COVID-19 that are appearing worldwide. This immune series is formulated to activate your T cells, which may help resolve symptoms. Symptoms such as fever, gastrointestinal distress, racing heart palpitations, headache, migraine, autoimmune dysfunction, even brain fog. These are all signs that your body has not conquered the virus. Perform this series of immune exercises 3 to 5 times a day, and if you begin to feel better, you will know that your condition has improved. If this is not the case, go see your doctor. The immune series is formulated to activate your T cells and may help resolve the symptoms of COVID-19. So, watch this translation of Mr. Gu's experience to see the proof of how his exercises worked. Please like it and share it with others who need it. You can leave your comments below, and thank you for watching.
Hello， 大家好，我姓顾，叫顾承德，出生呢1946年10月31号。这一次呢，我是被传染到了新冠病毒。在2月28号那天，我感觉到突然浑身无力，站不起，也坐下也难过，胸口闷，觉得人无力。结果没办法，打了911，送进了医院。到了医院，当然第一天很忙，是检查等等，就是人很多，大家都躺在急救室里，大概待了1天吧，有了一个临时房间。到了第3天，才有正式的病房，我就住进了病房。住进病房的时候，那心安了，就开始关心自己的身体了。这个时候，每天医院都会来好几次测量你的血氧，来检查，结果就发现了一个问题，我这个氧气呢是开的数字是6，我的血氧呢一直是89、88、90，超不过90。我就问医生了，我怎么会这样呢？医生说你一直这样，你进来的时候救护车就帮你开到了6。 那我知道了。那一个问题就来了，为什么会产生开到6，它仍然上不去呢？我就想到了，这肺是不是给新冠病毒这个毒把肺的神经给伤害了，这个神经瘫痪了。我想到这里，我就用手去摸这个中国传统的肺经的中府云门，摸上去没什么大反应，那我就想到了神经的反射作用都不强烈了，那就是个大问题，一定要解决的。当时我有了这个想法以后，我就用手不断的去挖、抠，然后用手指，代表就是中国传统的中医的针灸刺激，我就反复敲、敲、再敲2遍，不停的敲，敲了以后，再用这个不断的震动，累了休息一下。第2次我重复又做了一次，这个时候我用手摸的时候，明显痛感很强烈，那就是说它又苏醒了。既然它能苏醒，那肺的功能是呼吸功能，那就得用呼吸去配合。传统的东方呼吸是2种，一种是深一吸一呼深的，一种是浅的2吸1呼。在这2种我试了，用1吸1呼，它进去以后，肺里面可能有很多垃圾，它直接把它推出来，那就产生一种什么咳嗽。结果呢，只能用吸吸呼。那么在病房里我不可能做，我就这样躺着，敲的过程中，来做。就在这个做了以后，1个小时以后，护士又来检查，突然发现我的血压从90不到跳到92了。大家都觉得很奇怪，我也挺高兴的。结果就坚持做了，坚持做了，就产生了一个效果。很快，我的血氧提高，他把它放到3也能达到90。很快，就是说医院认为我很多解决了一个肺就是神经不兴奋的问题，解决了。好了，先讲到这里啊。好，现在我让大家看一下啊，这个是2，你看到了没有？我是盖到2，因为我现在不需要很大啊。这样以后就像医院一样，带着氧气做吸气呼，再敲。这个呢就是说，先把它放上去以后，你看着啊，先89啊，现在89以后，我开始做。现在93了94了，看见吗？它慢慢就自然，你不敲，它也能达到95了。这就是这个吸吸呼的好处。好，现在我就再讲一个问题啊。平时像我现在平时基本上不用呼吸器，只要在自己发现它的数值，现在你看。这个数字 96、94，如果它下去了，就做呼吸法。对，它会下去，它维持不久，因为终究是立不住。比如说，现在到了92，我就要做呼吸法了啊。比如一边敲，一边吸腹，这样它就是没有呼吸机，它也能达到95，这就是通过自然的95、96。但是呢，这就是你平时在没有呼吸机的情况下，你也能做得到，这就是达到正常人的正常标准。但是因为终究年纪不轻了，所以它维持不久，就是说你要反复做。所以我把我的经验得新冠病毒经验，而且把新冠病毒最可怕的就肺的神经没有反应，最后用就呼吸机了。如果有反应，他就不需要用呼吸机，那每个人都能把这条命留下来。所以呢，我的2个学生 Jennifer 跟 Cam 他们会仔细的讲解，因为我的英文不好，他们会讲解。Cam 有可能也能变成西班牙文打在下面，就是让大家充分的理解，因为一个真正患过的人，他经历过肺神经的，就是功能的不正常，经历过，所以他有切身的体会。如果能把肺神经激活，我相信很多人都能够活在这个世界上，不会走。所以今天呢，我就把这个3段让大家看一下，了解一下。至于其他，让我的学生来说。好了，祝大家身体好，祝每一个患有新冠病毒的人都能像我一样，走向康复，走向正常的生活。OK， 谢谢大家。
Hello, my name is Hilary Zeltner. I'm with West 57th Street Acupuncture, and I'm here today with the man who literally saved my life and has helped countless COVID-19 sufferers, Mr. Cheng De Gu.
Hello, I'm Mr. Gu.
Mr. Gu is a master of Oriental medicine, and he wants to share his knowledge to help people battle the aftermath of COVID-19. My colleague, Jonathan Fung, has introduced people around the world to Mr. Goos Exercises on YouTube to increase the oxygen saturation levels in the bloodstream. I'll review that information with you and share Mr. Gu's story, as well as introduce another set of exercises that Mr. Gu created designed to strengthen your immune system. When Mr. Gu got COVID-19 and was admitted to the hospital, his blood oxygen level was under 90, and it remained there until he realized that the virus had possibly attacked his lung nerve. When he checked the lung area, he felt only numbness. He realized that the lung wasn't working, which is why there was less oxygen in his blood. In our opinion, using Oriental thinking, we know we need to stimulate the nerve and let this become active. As Mr. Gu calls it, making the lung nerve wake up.
Yes, for me, important. Make a nerve wake up, then you can do another breathing. Otherwise, everybody say, you need to make a breathing better, but difficult made. When you do breathing, you cough, mean you can't do. So first you need to open the lung nerve. Make a nerve awake, then you can do breathing. Make better breathing.
As Mr. Gu calls it, make the lung nerve wake up. Then the lung can work again. So at this point in the hospital, Mr. Gu tried to press and stimulate the lung nerve area just using his fingers. And doing this stimulation is just like acupuncture.
Yes.
But at first, there was only numbness. But with more massage, he was able to feel the area getting more sensitive. He felt pain.
This is good news.
The presence of pain through stimulation means the lung nerve is receiving signals from the body. When he felt pain, he realized that the nerve was waking up.
Yeah, it's going to work.
Now, this didn't allow the lung to function yet, but it was an important first step. When Mr. Gu tried to breathe normally, as he said, just one deep inhale and one deep exhale, it only made him cough. So he called upon his knowledge of ancient Taoist teachings, and this way of inhaling he found worked. 2 short breaths in and 1 long exhale. Suddenly, he realized that he was able to get his lungs to work properly, and his blood oxygen level went up. For this exercise to be successful, it requires 2 motions. Active stimulation, as he said, combined with Taoist-style breathing. Mr. Gu did this 1 time, 2 times, and 1 hour later, his blood oxygen numbers were higher.
Yeah, this is my experience. So if you want getting better, you can try.
Oxygen go in, oxygen goes out, makes the lungs work. To increase his lung function, he created 3 motions, all done with stimulation and breathing to better open the lung from the front and the back, including stimulation from both sides of the body. This is the most effective way to tackle this issue. So the next 3 exercises show how to allow the front and back of the lung to open and operate efficiently. Mr. Gu wants to share his experience and success with this technique to help the many people now suffering with the after effects of COVID-19. He always says, "I'm not a doctor."
I'm Mr. Gu, so I just want to tell you my feeling, my experience. If you want better, you can try. This easy motion, not take you too much time. Short time, make better. In my exercise, very easy. Short time, you will get benefit. If body say good, make you better, just keep doing. If we body don't like, just forget. These 2 easy things.
He found a new way to increase his oxygen level and allow his body to breathe easier. And he's here because he wants to help others do this too. We're going to introduce the COVID-19 lung exercises to make the lung nerve awaken. Now, these exercises have been introduced by Jonathan Fong, my counterpart. However, I'm just going to review them. And Mr. Gu has added some things so that you can learn how to stimulate the lung nerve not only from the front, which that's all you can do when you're in the hospital, but when you come home and you have the help of a friend or family member, then you can stimulate the lung nerve from the back as well, using these exercises. So number 1, how to check. You need to follow the lung line in Oriental medicine. Now this is thousands and thousands of years old. Before they had the benefit of anatomy, they used their experience to find the lung nerve. Where to go? You start this area. You have to touch with your fingers 1 by 1. Go down until you feel the tender or sensitive place. Now, the lung nerve here. It's different on every person. That is why you have to touch and stimulate the point yourself. For some people, the area will have no feeling. It will be numb, like when Mr. Gu was in the hospital. Then you have to continue to touch and massage the point until you're feeling pain. Pain tells you the nerve has awakened. So go ahead and touch, touch, touch. Feel pain there?
Yeah.
Pain, then rub. If your energy is low, do one side at a time. Do one time, take a rest, then repeat. Now, when the pain comes, keep massaging the point. You're opening the lung nerve, opening the point. Once you've been able to do that stimulation, then you're ready to do the other part. The lung point stimulation with the ancient Taoist breathing. Now remember, it's 2 short inhales and 1 exhale. How does it look? Let us demonstrate for you. Remember, you're using the finger pads. You're giving it stimulation. At the same time, you're adding the breathing. If you just do the stimulation, this will not work for you. So you need to combine the two together to make it effective. Mr. Gu did this in the hospital. One side, he did it once, did it twice, then he took a rest. 1 hour later, his blood oxygen levels went up. You can test this on your oximeter, and you will see the numbers going up. Remember, you need to find the area that has tenderness, sensitivity to the touch. If it's numb, you must repeat the exercise to stimulate the point until you're feeling pain. Pain tells you the lung nerve is awake. If you want to test whether the exercise has worked, get the oximeter and put it on your finger. Numbers don't lie. You will see the number and you will know how much better you get by doing Mr. Goos exercise. Now, when you return from the hospital back to your home, and you can ask a family member or a friend to help you, you can open the back of the lung. As Mr. Gu would say, make it more perfect. The way to do this, we have to open the points again on the back of the neck. So you go to where the lung area is. In Chinese medicine, it's along T3. You find against the spine, you feel the tendon. Where the tendon is tight and painful for the person, you rub there, make stimulation. Here, here, and here. Do one side, then you have to find another point called Tianzhong. First, you apply the stimulation. Then you add the breathing. Shaking once you found the point and open it. Now, I'm going to continue to apply the stimulation. She's going to add the breathing. Together, make the lung better. Finish one side, then take a break, then do the other side. The third exercise in this series is what we call the Japanese bow. This one, you're going to put your hands underneath your diaphragm. Find where the rib cage ends. Place your hands there. Now, for those of you who are weak and don't have too much energy, I want you to do this exercise with 2 quick inhales and an exhale, like this. Move the diaphragm in and up as you bend over and exhale. Strong exhale. The second version of the Japanese bow is for when you have energy. This one, you start with the same position, but this time, after you inhale, you exhale, you push the body forward, you press in and up on the diaphragm again, and release the air with the sound high, as loud as you can. This really opens up the diaphragm. Explain.
Ha! Ha! Ha!
This motion is to open the whole chest center. You're still going to use the breathing with 2 inhales and 1 exhale, but you're going to place your fingers here in the center of the chest to make the whole chest open as follows. Do the exercise. you'll see the lungs will have more room to expand. Now, these motions are for COVID-19 sufferers, but in order to make the lung better, you have to do the whole series. You have to do them for at least 30 seconds with a minute break in between each one. Then we have the next series of immune exercises to make it even better, to kill the virus. That is the real help. We just covered the emergency treatment for COVID-19, and these exercises improve lung function. However, we know that COVID-19 can severely damage a person's body. We also know that COVID affects the entire body and not just the lungs. That's why it's important to also strengthen your immune system to combat the virus more effectively.
Important, make immune strong. This is real help, not only for breathing. So make immune strong, mean make body T cell quality good. T cell in the thymus. So thymus, most people over the 50, 60, thymus shrink. So no blood circulation. So T cell difficult get good quality. So if you make a circulation, make a stimulate, then make your T cell get good quality. I think for every problem, T cell will fix. So if you don't know the T cell, you can do research. What's mean the T cell? After research, you will know body need good quality T cell.
So I've asked Mr. Gu to show us how to strengthen the immune system with exercises specifically focused on T cell production to increase your overall immunity. Many people don't even know where their thymus is, so the thymus is located behind your sternum, and this is where white blood cells go to mature and develop into the T cells that fight infection and direct the white blood cells in your body to fend off the COVID-19 virus. As Mr. Goos said, the thymus gland's function decreases as we age. So this set of exercises developed by Mr. Gu have proven to be very effective for many people. With Mr. Gu's assistance, I'll explain how to awaken the body's thymus with 4 simple exercises. Mr. Gu suggests that the exercises should be performed for 1 or 2 weeks before any improvement will be seen.
Yeah, I teach this exercise in America almost 30 years. I teach a long time in the American Connecticut Greenwich Hospital. Teach this immune. So people never know, but the result, people getting better. So exercise is simple. You don't need to pay money. You don't need to find a place. So any people, you can do this exercise. Only you want to do, you like to do. She will make you better. So this for everybody, easy. Everybody, not to say you have money, no money, everybody can do. Then benefit is very quickly.
As Mr. Goos says, do the exercises, just continue and be patient, and many people will see the results.
One thing, if your family member can help you, this easy. You can, what's help? Spine, nerve. This area nerve goes thymus. So need to check this nerve. Is normal, not normal. So make spine straight. Then check, close the spine. Check one by one check. One by one. Finish one side, go other side. Important things. Most people, immune no good. 2 happen. One happen, she tell you no feeling, like nothing. You little strong, she's still feeling nothing, mean nerve sleeping. Another things, you touch, suddenly she tell you, wow, so pain, face red. You open the neck, the bladder suddenly open, like highway before closed, now open. She face suddenly red. This means you find the point. Then rub this point. Lift head until she feeling whole neck get warm. After this open, then do thymus turn. Yeah. Thymus close here, so you need a thymus rub. This one thing, if help people, people help. No people, person can help yourself. So this after, then use the here muscle, here soft, beat. Let inside shaking, make whole organ shaking. After shaking, rub. Use your energy, palm here energy, hold it. Rub, chin in, body bounce. Whole spine shaking. Energy go thymus. Make thymus inside warm. After this exercise, you use this way, check. You find, oh, inside warm. This means good. Sick people after this, she feeling energy.
The second exercise in the immune series is for your liver. We call this exercise the monkey. Now, many people don't know where their liver is, so when you raise your right hand, take your left hand, put it across your body on your rib cage. That is the area of your liver. The idea for this exercise is you put your thumb and your middle finger together. You take the top of your hand, you lift it up straight as you suck in the stomach and try to raise your liver. Now, this massage, go ahead and suck in and lift. Suck in and lift. Make the arms straight up. This massages the liver. It massages the diaphragm. These exercises are not to make the body beautiful, but to make the organs beautiful, as Mr. Goos says. The third exercise, we're going to stimulate the marrow. Now, the marrow is located in the long bones of the body. So especially the femur, that is the longest bone, you're going to make your hands into fists, and you're going to beat in the middle of the thigh. At the same time, you're going to bounce in your chair and you're going to clench your teeth. When you stimulate the marrow, you are helping your body produce red blood cells to help your breathing and white blood cells to help fight against any infection. By clenching your teeth, you're stimulating your gums to also help produce more immune. The next exercise is for the lymphatic area. Now this one, we would like you to wear shoes because you're going to have to stamp your feet. The idea is you're going to be shaking the marrow of the long bone, and at the same time you're going to open up the lymphatic area of the body, which is underneath the arms and all along the sides and in the creases. So how to do this exercise? When you begin, you put your knee up and your elbow near the knee. Then you open, okay? Bring the arm up, stamp the foot. Keep the chin down and also be aware you want to keep your head up. This will give the greatest stimulation to the body, like this. Now you've done one side. Take a 1-minute break. Each exercise should be done for 30 seconds. If you have energy, you can increase the time to 1 minute. But very important is to take a 1-minute break in between each exercise. So now, do the other side. Again, you're going to bring your knee up, elbow down. That's the starting position. Then open. Make sure to keep the chin down and the head up. Underneath your collarbone, you will feel an indentation on either side of your sternum. Go there and massage that point. Then, placing your thumbs in that area, place your elbows out to the side. Now, it's important to keep the elbows at this height because you want to stimulate this line. Don't fold the elbows back, just bring them out to the side. If you go to the back, you're only helping the joint. That's not what we want with this motion. Elbows out to the side. Add to the stimulation the breathing. 2 short inhales, 1 exhale. As you do the 2 short inhales, finish with the exhale, take a step. Notice how she keeps her elbows out to the side. You're stimulating the thymus gland with this exercise. Thank you for joining us today. We hope that these exercises will help you as much as they have helped so many others all over the world. If you are interested in hearing more about how the exercises created by Mr. Goo to increase his blood oxygen level, please follow the links in the description below. And if you're interested, you can verify the results yourself with the oximeter. Thank you for watching.